I'm GREYMOND. I'm an expert in OCD recovery because for the last 19 years, I've been helping people fully recover from OCD. If you would like to do personal coaching with me, all the information is on youhaveocd.com. You can sign up from there. Let's talk about my favorite topic, treatment-resistant OCD. Dear Lord, I can go on for hours about treatment-resistant OCD because it's the stupidest label that you can probably put on OCD. I can tell you, I've done work with clients for 20 years. There is no treatment-resistant OCD. There's people who resist treatment, yes, but there is no treatment-resistant OCD. The basic OCD model is rumination plus compulsions plus avoidances equals your level of anxiety and your level of OCD. So the more compulsions, ruminations, and avoidances you do, the higher your anxiety will be and the stronger your OCD will be. The less of the behaviors you do, the weaker your anxiety will be and the weaker your OCD will be. If you stop doing all of the behaviors, your anxiety will stop and your OCD will stop. That's the basic model. There's no doctor in the world that will diagnose you with OCD if you say, I have no rumination, compulsions, or avoidances. You need those, and you are doing those actively. So any person that comes to me is doing some sort of combination of those three. Maybe just rumination, maybe just compulsions with tiny bit of rumination, maybe a lot of avoidances, maybe no avoidances at all, right? So, but there's component of at least one of those that's there. So the treatment, right? The recovery process is to get rid of these behaviors. To recover from OCD, you need to get rid of the behaviors. I just want you to follow me on this, okay? So when we're saying treatment-resistant OCD, we're saying that the person is not able to get rid of the behaviors, right? Now let's start digging into it. Why is anybody not able to get rid of the behaviors? Number one is they just don't want to do the work. They're not ready for the level of work. They don't want to do it. Their heart is not in it. They're not that focused on it. That's a very common one. So, and I see a lot of the time people will come to me and they'll tell me, well, not a lot of time, but sometimes I see this, where they'll say, I have 10 different doctors who are trying to help me with OCD. I have the specialists from around the world. That tells me right there that these people, these specialists from around the world, are running circles around this person who's continuing to do the behaviors. And it's almost the same idea of like, I'm going to hire a personal trainer so I can, in my mind, put a check mark, I have a personal trainer, but I'm not actually going to go to the gym. Right? So it's versus I have clients who will come to me and they'll say, I already did a lot of the work myself and I just need correction in these few things that I'm not understanding, right? So it's not about that you need all of these people around you to help you recover. You need to actually want this, be in it, lock in, okay? So again, number one reason, or one of the reasons is people are not locked in. The second one is they're getting incorrect information. So they are locked in, they're trying, they want to recover, they're doing everything to recover, but their doctor told them that this is let's say, childhood trauma. And they're digging there. And of course, they're never going to recover because the method is wrong, the approach is wrong. Or let's say they're fully focused on recovery, but they're doing one exposure a day and thinking that this is enough. Be focused all you want. One exposure a day is not going to do it. So then they're labeled as treatment-resistant OCD. But it's just that the method is wrong. But if a person, right, says, okay, let's say, ruminated this amount of time, I did this many compulsions, let's drop avoidances for now, because avoidances is kind of like a separate situation. I don't want to get into it, but compulsions and rumination. So I do this at, let's say, a high level. I'm going to try to drop that level. So instead of doing 100%, I'm going to reduce it by, let's say, 20%, my avoidance or my compulsions and my rumination. Well, the anxiety is going to drop by 20%. Maybe not the same day, but in next weekish, the anxiety will drop by 20% because you reduced the feeding of OCD by 20%. And it doesn't matter what you label your OCD, treatment resistant, not treatment resistant, you will recover if you keep dropping the level of behaviors, compulsions, and ruminations. And at some point, also avoidances if you have it. So if somebody incorrectly labeled your OCD as treatment resistant, believe me, it is not. Your brain is absolutely capable of full recovery. Absolutely. I have zero doubt in my mind that you can recover. Don't listen to these people. They don't know what they're talking about. It's not childhood trauma. It's not that you're incapable. It's not some deeper chemical imbalance or whatever. It's just that you are feeding the disorder at a certain level and the disorder remains at a certain level. So even if, and you know, I say this, that try to reduce the every week by 20-25%. So we get to around 100% at the end of the month. But let's say maybe it's very difficult for you because of I don't know, job stress, life stress, a lot going on, whatever. Reduce by 10%. We'll get there in a month. We'll get there in 10 months. Reduce by whatever you can. Any reduction will get you to the end goal. I always say this kind of like as a joke, but it's true that even a snail will get to the end of the street at some point. Hopefully, you know, we're more of a gazelle, but if we're a snail, then we're a snail, and we're all a snail in some sort of situations in life. And I can tell you with the treatment resistant, I hate that word so much, but with the treatment resistant OCD, the most common thing I hear with clients when they come in and they say this is that they're just not using enough method. I would say not using the right method. Sorry, it's they're not doing recovery work correctly. And when we start to identify like, oh, but they're like, I'm not feeling better. I've been doing this for years. I'm like, well, are you doing this? Are you doing that? Are you, you know, and they're like, oh, no, I'm not doing any of it. My doctor never told me this. And it's like, is this a surprise that they're not recovering? Right. And again, they start to do the right thing and they start to recover. Treatment resistant OCD became treatment, congruent OCD, right? So, yeah. So absolutely, you can recover, but the work needs to be done. No excuses. Track, reduce. Reduce the behaviors. Thank you for listening. If you have not subscribed, please subscribe. If you would like to do private coaching with me, please sign up through youhaveocd.com. I'll see you tomorrow.